Hi, GP learners, and thank you for joining me this session for our live stream where we're going to be covering the new updates to SystmOne, and particularly those ones that should help you with managing the COVID vaccination plans that many of you I know have been working towards over the past couple of weeks with the announcement of the enhanced service. And for this episode, I'm proud to introduce Dr. John Parry, who many of you probably have come across and heard of, and he's joining us from SystmOne. How are we doing, John?
Hi, great to be talking to you today. Thanks very much for your time.
No problems. So just to remind everybody, we are streaming this live. If you are watching on recording, hi, hope you're doing all right. And we are happy to take questions through this stream. I'll probably take them at points. So if you do have any comments or questions, do stick it down either in the chat on Facebook or YouTube, whichever platform you're watching us in, and we'll try our best to answer your questions throughout this stream. But in particular, in this episode, I know John wanted to talk through some of the amazing work that SystmOne's been planning to try and get through to help all the practices with the COVID vaccination, as well as a massive piece of news I know we're going to give towards the end, so make sure you stick around for that. But with COVID vaccination, John, I'm guessing it's kept you guys busy, hasn't it?
Yeah, it's been a really interesting time, I must say. I think the code word, of course, is it's evolving, which means that there's a degree of chaos and confusion everywhere. But from our point of view, we recognized that we wanted to do some very specific things to make SystmOne ready without necessarily knowing how it was going to be used, because certainly the very clear messages from the centre remain that the recording of COVID vaccinations will be done in third-party software, so farmer outcomes in effect, because that means that they can control that particular data flow. That's been slightly at variance from what we've been hearing from our customers, both the large organizations at STP level that are being charged with setting up both Plan A and Plan B, in other words, an alternative process if things don't go according to plan, but also from our primary care customers, especially those already linked together in primary care networks who are being charged with setting this up at a locality level. So we took the view a few weeks ago to just make us ready, and then if it's used or required, so be it. For those who work in the health and justice prison estate, we do know that SystmOne will be used for recording COVID vaccinations to prisoners, and that's obviously for the technical things about not having mobile devices in prisons and so on. So we do have to be ready for that, and as many of our users will be aware, if it works in one area of SystmOne, it'll work in another area. So that's why we've done the piece of work and why we're currently ready. What I plan to do is to talk around some of the requirements, a little bit on the data flows, just to give people a bit of background on that, and then we'll move on to other things, if that's okay.
No problem. So where do we start?
Well, perhaps the data flow is a bit tedious, but interesting. As probably GPs are very aware, they've been receiving flu vax that have been performed by community pharmacists, coming from the farmer outcomes and the sonar systems used by the community pharmacists. That's been coming straight into SystmOne, and that comes in as a structured message, which has to be processed as a task. Now, that's going to be exactly the same methodology used for receiving COVID vaccine information. And our expectation is whoever does the COVID vaccine will be sending that to us in SystmOne for the registered GP to have a record of the COVID vaccines. Now, the big change coming in on Thursday's release is that we're going to fully automate that process of receiving the message and filing it and creating the structured flu vaccination in SystmOne. It's an option that can be turned off if a GP practice wants to do it all manually still, they can do so, but we're actually on this occasion defaulting it to on because we assume people will want that to work. So going forward, all the COVID vaccines coming through from farmer outcomes will actually end up directly in the registered GP record. The only time where it will drop into the task inbox is if allergy information has been sent subsequent to the COVID vac being given. So if the patient has an immediate reaction, and technically we think that needs to be within the 15-minute window of observation, that will be sent through in the COVID message, and that will trigger a flow into the inbox so that it can be interpreted appropriately by the clinician and encoded. That's the only time you should get those coming into the inbox.
So just so I understand that clearly, if I have a patient that goes, for example, to a mass vaccination site, so doesn't have their vaccine at my practice or my network, normally you would have said that we would have got a message come through as a task that then would have needed the clinician or the admin team to file and sort. As a result of the changes you're making, that's going to happen automatically unless there's been an allergy indication for that patient, in which case it will still come through to the practice to deal with manually.
Absolutely so.
Okay.
This is where the pathways of data get a little bit confusing, because we assume that the mass vac will come straight to the registered GP. If it doesn't, it'll go straight to NIMS, the National Immunisation Service. And there's a route for NIMS to send to NHS Direct, and then NHS Direct will be sending the messages to the GP system suppliers for the registered GP. Whichever way it comes, it's going to be the same story. It'll automatically file with a structured vaccine unless there's some allergy information. So it doesn't really matter which pathway they choose to follow. So that's the first big information flow. The second one, of course, again, is up and running now, and that is that every day, every flu vaccine that's performed and recorded in SystmOne flows to NHS Digital. That will apply exactly the same way to any COVID vaccine recorded, and that flow is then NHS Digital back into the National Immunisation Service. So the single source of truth of the status of an individual patient is held by the National Immunisation Service, and hopefully by the registered GP as well when this is working properly. So those are the two major information flows, both of which are tried and tested. I think we've received over 1 million flu vaccinations from the Sonar and Pharma Outcomes process this year alone. So we know that works. So they're the big things. Moving on to actually using SystmOne for recording the COVID vac. Yes, that's all sort of set up. We've got the COVID vaccines in place. They're mapped to medication, or at least they will be after our release cycle. You'll be able to do the data entry requirements. And I have to have a wry smile here. We're putting into the release the GS1 compliant barcode reading, so that you'll be able to hold the COVID vaccine and zap it with a barcode reader, and that will populate either the vaccine template ready to be applied to multiple patient records, or on a patient-by-patient basis. I have a wry smile because we've heard that there aren't actually going to be any barcodes on the first lot of COVID vaccines. But when they are in place, it will work. And later we'll extend that so that you can do it for all vaccines that you need to record as well. So those are the two big requirements.
If I can ask then, John, talking about barcodes, I mean, using barcodes in practice is something that I know became a big question when the flu vax program for this year kicked off. Many practices were looking at how they could use barcoding to potentially manage, their clinics and that kind of stuff. I guess if a practice was looking at how to do that, is there any way you can suggest where they can have a look for the best way to get that up and running with SystmOne if they haven't already done so?
Yeah, so again, SystmOne is compliant with a standard barcode reader. So if you've got an NHS number barcode created within SystmOne and sent out in a letter, you can use that to pull up the patient record as they arrive. It won't obviously register the patient, but it will find the patient. So literally they walk up with a letter with the barcode on, you zap it with the barcode, it will retrieve the relevant patient record. That's already in place now.
Okay, cool.
Okay.
Yep.
Sorry, I was going to just move on a little bit, make sure I've covered everything off. One of the other data flows that is important, of course, is the summary care record data flow. As all GPs will be aware, we put in place the additional information summary care uploads earlier this year under the COPIA regulations. So every patient, unless they've got a specific dissent, will have an additional information summary care upload. And of course, the COVID vaccine flow will be triggering summary care record uploads as well. So you will be seeing larger numbers of records in the summary care record upload list. And I would encourage practices to keep that flow going. Don't let it get too huge. Keep somebody smart card logged in on a machine so it can just churn away in the background. the final thing, again, users will be very, very familiar, especially when such great work as yourself, Dr. Gandhi, puts out there, is the way of trying to make this simple and fast. In that creating a protocol that can say, is this the right patient? Yes. Checking, have they had a COVID vaccine in the last N days, which will either be 7, 21 or 28, depending on what the rules come in. Have they had a flu vaccination within the last 7 or 28 days? Again, depending on what the final rules on that are. I think there's talk around a specific information questions that will need to be asked for each individual vaccine, depending on whether there are particular attributes of the vaccine that means that it can't be given to certain groups of patients. That could be in questionnaire format to go through very quickly, to record consent, again, if that needs to be recorded directly, as we assume it will be, and then yes, give vaccine, press yes, and apply the vaccine template, record it all into the record and save the record. So the experienced users of protocols will know how you can build those components. What we're hoping to do, because we need to do it for the health and justice estate, is to actually build those components and put them out there on live for everyone to use, or of course copy and tweak according to what they want, particularly for their own areas. So when we've got more vaccine specific detail, we'll be able to do that hopefully in the next couple of weeks.
Cool. No, that sounds amazing. And I know having that created already and then potentially being amendable just makes hopefully life a lot easier for the practices and the teams trying to deliver this.
One hopes, because of course this seems to be on top of the day job as well,
Yes.
which is quite challenging. What else do I need to cover off? One of the conversations you may be involved in, of course, is at STP level or community trust level, people saying, well, actually, we want to set up a separate SystmOne unit to do our mass vac or our roving service or whatever they do. So we're just so you're aware, we're recommending that we use a type of unit which I'd never heard of before, called a community medication or community medicine unit, which is a vanilla community unit. But the advantage of using that particular type of unit is that it doesn't require the community user to enter any of the referral in information. Community users generally have to record the referral in information ready for their community data extracts. This particular unit doesn't do that. So it's literally, if you're logged on with SmartCard, which hopefully there will be, you either enter the NHS number or you enter forename, surname, date of birth, search, select patient, and you're done. You've done the registration. So you, in terms of a pathway, if you are going to use this type of unit approach, you have somebody registering the patient, they save it, they move down the pathway, the next person retrieves it, applies that protocol I was talking about to do all the twiddly bits of inquiring whether they're appropriate for this and applying the vaccine, and then you're done. What we haven't covered off, of course, is reporting requirements to ensure that the patient is suitable or appropriate to have a COVID vaccine. Again, I think I'm waiting more detail on that. It seems that the cohorts at the moment are pretty straightforward. They're going to be the over 80s or the over 85s, the people resident in a care home, the care home staff. So you've got fixed cohorts that you're not going to need to test against. When it gets further down the line and you say, well, actually, we're going to take the over 50 flu cohort, then we can start plugging in the testing to make sure they meet those requirements. But I think that's going to be probably in the new year, I guess, depending on vaccine availability. So I think that probably covers off everything in the COVID update from our point of view. But I would love to hear from any folks online as to particular issues or questions they have.
Yep. So absolutely, if there are people with questions that are watching us live at the moment, you've got something you want to ask John about that particular topic, stick it in the chat. We'll more than happily bring that on and ask them. I guess whilst we're waiting for people to add any questions, I did have one about what you mentioned about the community medication hub. So I guess if practices or networks want to kind of bolt that onto what they're currently using, what kind of process and time frame would they have to be thinking about for that to happen? And I guess the inevitable question is also about cost as well that comes up as well.
Yeah, so one of the key things about this is that we're not actually trying to make any money out of this. So most of what we're doing is actually going to be cost-free to the NHS. So hence well, we don't care whether they use it or they don't sort of attitude, but we do want to make sure the data flows correctly. Thank you for pointing that out, because I think hubs generally will use the GP hub unit, because that comes with the ability, the much more straightforward ability to share information within an organization group, and also to set up the booking directly into the hubs, because booking of appointments is something that actually has suddenly in the last couple of days come up, and I'll talk a little bit more about that. Thank you for reminding me. When I'm talking about community medicine units, they're really for STP or larger area setup. We'll just be asking people to apply through the usual way into SystmOne inquiries to do that. And we're expecting to be able to turn around units within 2 or 3 days. It's a pretty quick, slick process.
Okay.
It doesn't take a lot of time. And again, so we're going off now down into a bit of a rabbit hole, which I won't dwell in. But
Sure.
there are complexities around the ODS code, the organization code, that some of these units will have. And the slightly, well, it's not fully formed message from the centre is that some of these external units will need to have their own ODS code in order that the information can flow to the National Immunisation Service correctly.
Okay.
If in GP land, if you've got a GP hub set up, that will have all the codes in place to do it. And it will be much better to use that sort of environment without introducing complexity of another unit. But that, I think, as I say, is an evolving area at the moment.
Sure.
Talking of evolving areas, booking is another interesting one. Is that we've in the last couple of days we're on call to the NHS Digital to ensure that the GP Connect booking service is available. Now, many users will be aware we've done that work. It has full rollout of approval. It's in use in a number of areas. This will particularly support where you've got an EMIS unit at the hub and a mixed economy of GP users underneath, and vice versa, a SystmOne hub at the pro. That should just work. So if the instruction from the centre is to use GP Connect to enable booking into these services, that should just work. And then I think the slightly confusing bit is the model I think they're talking about at the moment is that GPs will use the direct booking into a hub unit and then use farmer outcomes to record the COVID vac. So that's the sort of fly in this ointment. As I say, it's not a fly for me because I don't mind either way. I think the burden of learning extra systems to use is the one that the GPs will find potentially difficult. But
Yeah.
we'll watch this space over the next week. We've got calls every day from various groups of people to try and sort out what's going on. So I hope I haven't confused everybody at the end, but the current message is use farmer outcomes to record the COVID vac and do whatever you like with other systems to make it work best for you.
Sure. And I guess just to clarify the other point, so you mentioned obviously some hubs that are using SystmOne for their booking and for their organisation and things. They may obviously cover practices that aren't SystmOne based, like EMIS and Vision. So if they are using, end up using the GP hub method for documenting that, and obviously we're waiting confirmation as to whether or not that's available or not, how will that look for EMIS practice? Will that come through as a PDF, as sometimes it tends to do, or will it come through in a different way? And
So again, a very good question. So first of all, the clinical governance side, if you're in a mixed economy, you could, of course, set up the HTML using the GP Connect Fire approach. That again is available and working, and EMIS can see the SystmOne record and SystmOne can see the EMIS record. So that would provide a view of what's going on if that's required. And hopefully the summary care record will come into its own. There's a third approach, and that is a direct lookup into the National Immunisation Service. The specifications for that came out a few days ago. We're again putting into this release nothing that users will see, but some architectural infrastructure ready to use that. So again, there's a possibility that if you've got a mixed economy, you'll be able to query the NIMS, get the absolute final status of the patient to make sure you're not duplicating or whatever the vaccination. So that, again, there'll be more information of that later. But generally speaking, the mixed economy should be supported by the existing methodologies that we have.
Awesome. Cool. We have had a question that's come in. So unfortunately, I don't have a name because I think they've not authorized StreamYard, but that's fine. So the issue is reporting back to CQRS as they won't pay unless the vaccine done at home practice, then need to do a manual change form. Is this something that is an issue, I guess, or could you explain that?
I mean, certainly the most important thing is making sure the information is attributed appropriately. I mean, SystmOne clinical reporting you will be able to derive lists of patients who've been vaccinated by the service that is claiming that, and of course the GPES extract will continue to take this data. What I haven't got yet is confirmation as to whether CQRS will do this from the GPES extract or whether there'll be a manual process. If there is, the clinical reporting will be able to do that. Again, the incoming messages from done elsewhere will be attributed to elsewhere. So the clinical reporting to look for the COVID vaccination done at this organization will ensure that that gives you the appropriate answer for that.
Awesome. So we talked a lot about COVID, and obviously COVID's definitely on people's minds. I know if people do still have any further questions, feel free to stick them in the chat and we'll answer them towards the end. But I know the other thing that we wanted to share is you've got a pretty major update coming, haven't you? And something that I know when I found out about it sounded amazing. I'm going to give you the floor, John, but I think you've got a pretty big announcement for us, haven't you?
Yes, I'm going to delay that for just a second. Some of the most interesting discussions on Twitter at the moment about automating patient care in individual patient groups such as hypertension and so on, and we're very much wanting people to trial Airmid. For those who don't know, Airmid is our free of charge patient app. It links directly to the GP and to the community and to the hospital and other records as well using SystmOne. It supports video consultations. It supports directed notifications to individual groups of patients as an output from clinical reporting. But one of the things that is most exciting is the ability to build content within SystmOne and push it to patient groups. And at the same time, when it's your content that you're asking patients to fill in, for that data to come directly back into the GP record as coded data for onward reporting. So, for example, a group of patients who you want to check on their experience of their medications, you can ask them for side effect lists and it can come back in. But what's been on Twitter has been the idea of taking, say, your hypertension patients and automating the patient entry of their blood pressure readings and then escalating their care accordingly, depending on what results you get back. Well, so that's the exciting stuff in Airmid. The bit that's new is to use this same technology to support the idea of online consultations within Airmid. So we've been working with our friends at Arden to create some really beautiful content that we're going to push out into Airmid, and that means that online consultations will then feed from the Airmid consultation directly into the GP record, which I think is going to be really exciting. We're piloting that. We're releasing some of the technology this Thursday. We're going to pilot that with a group of practices, and we will be tweeting a link to the online form that Rob Greville-Haygate's kindly created at Arden's to recruit practices to do that. As I say, it's free of charge and directly integrated in the record and does support online video consultations as well. So I hope that's of interest to the users. It's really quite interesting stuff. Some might say it's a bit late, but to be fair to us, Airmid came on stream earlier this year. We pushed it out much earlier than we expected to push it out in response to the COVID situation. We wanted to get other platforms out there that people can use. And we expect that to develop over the next 6 months really into a really astonishing platform that practices can use to both automate certain groups of care, recruit digitally enabled patients, so they know which groups of patients they're using which modality with, in effect, so that the ones you've trained up to use a digital approach can be used in that way. Patients who are digitally disenabled can actually use different pathways of care, and we can actually have a clear knowledge of which patients are using which service.
Mm-hmm. And I guess just to be clear on that point, so effectively what you're saying is that pending tomorrow's update and uptake with the pilot sites, that SystmOne will have integrated online consultation flows for patient care, which is obviously something that clearly hasn't been there up until tomorrow. And I guess that, to me, that sounds really interesting because it doesn't require having to use an additional system to manage those online consultation flows, which I know for many practices is sometimes a challenge, shall we say.
Yeah, and just to be clear, because obviously Rob has a great product with Ardens that people can subscribe to or not. This particular component will be available to all SystmOne users. There won't be a charge for that, and there isn't a charge for Airmid. And of course, Airmid, for those who aren't aware, if you want to move your patients who are already using patient-facing services, the existing System Online username and password will work in Airmid, so there's no work in moving them over. It's available on Android and iOS, of course, and it's a much nicer experience, and that has more comprehensive functionality within it.
Mm-hmm.
Of course, if you want to recruit new patients, they can actually self-assert their identity using the NHS login. So if you wanted to send out text or letters to a group of patients and say, please download this app and get online, they
Mm-hmm.
can do so without having to come to the practice. They haven't got to bring their identity checks and so on. And as I say, a key difference, I think, between this particular approach and other online platforms, which people are using very widely at the moment, is that it is linked directly to the patient record. So when you're talking to the patient, you have got that identity asserted link in place.
Mm-hmm. So a bit more confirmation in terms of the ID and the privacy and potentially that side of things.
Yeah.
And like you say, absolutely integrated with the records. I think one of the more recent updates has also meant it's easier to do video consultations direct from the booked appointment, isn't it, as well? I've seen that functionality that before I think you had to change the appointment slot, whereas now it's just like, instead of calling a patient and you can turn it into a video consultation.
And I guess in context of general SystmOne development, we've got a team who are developing Airmid, who are doing release cycles in the same way as we do our release cycle for SystmOne itself. So it will continue to move on. One of the really exciting areas is we're working with researchers who want to set up research units that will also link to the same Airmid app and push information requests out to patient groups and get information back in for research as well. So it's a very broad platform. We don't see that that's going to wipe out all the other platforms. Other platforms have got great functionality and great utility, and people are used to using them. But we see this as a way of integrating care in the digital space going forward.
Sure. And I guess just to explain to our viewers who are watching this live, or potentially those who are watching this on the recorded element, on the 16th of December, at the same time, so 12:30 to 1:30, we'll be joined, but again, by the SystmOne team, as they actually give us a demonstration of what this new online consultation and Airmid combination platform is actually going to look like. The reason we couldn't show you today is because it comes out in the update tomorrow. So therefore, obviously, we wanted to make sure that we had something that was sensible and reasonable to share with you. So on the 16th of December, feel free to join us. If you're looking out for the thumbnail, so that's coming up on screen, this is the one you need to look out for. And it will be available shortly and probably at the end of this video in a few minutes. Additionally, John mentioned that sign up for the pilot practices. I'll be putting the link for that down below in the show notes. So if you're watching us on the YouTube channel, just head over to that, and right at the bottom, in about 50 minutes after we finish, you'll see that link there. So you can click on that and register your interest if you want to. But as John mentioned, this is functionality that's going to be available to all SystmOne practices post the update going out. And it sounds like you guys have got plans for developing it even further as time obviously goes on with those pilot practices and stuff.
Certainly, there's a lot of functionality, additional functionality that will be going into Airmid as well. I mean, we already support the barcode for the EPS, but I think there's a move to actually make that barcode the legal token. At the moment, it's a representation of the barcode that you would have on the token, but we're moving that forward as well because EPS is such a hugely successful area of NHS usage for many practitioners.
Sure. We have 4 questions. So we've had about a question about where we've gone. So there's this comment about different IT systems. It mentions that obviously other companies like Accurix and stuff have been doing stuff to try and help with booking appointments and that kind of stuff. But effectively, unfortunately, we are stuck waiting for the official decision from the centre as to how a lot of this is going to work. So just to reiterate that point, that it sounds like John's team has been doing loads of amazing work to try and support this, as other people have, but we are still stuck waiting for the official decision in terms of what everyone's going to be allowed to use. More specifically, we've had questions about Airmid. We've had 2 questions fairly similar. So from Linda Jeffrey, she says, are we currently able to see who uses Airmid at a practice level? And to be honest, Nick's asked pretty much a similar question. Is it possible to find out which patients have downloaded and are using Airmid at this moment in time?
Yeah, I'm going to carry those 2 questions over to the next session so we can show you what you can see. One of the difficulties, of course, Airmid users may be downloading Airmid for other purposes. And so we have the difficulty of actually knowing whether they're going to link to the GP record. I mean, certainly in terms of closing the loop of care, one of the things that you can set up now, of course, is the automatic searching of what happens. So, for example, you can send to a cohort of hypertension patients a questionnaire or a template, and what they then put into that gets recorded in SystmOne. So you can then run a report to look for one component that they will be recording to see whether they've used it. So you've immediately got a closed loop between sending out a request for information, that information coming back into SystmOne, and you measuring that it's been done. So if you, from a governance point of view, if you want to make sure the patients are doing the thing that you want them to do, just report on that activity a week later to see that it has been done, and you've got a closed loop in that way. But I'll ask them to look at actually demonstrating that some of that reporting functionality in live SystmOne, and actually knowing which, because you can already report on patients registered for patient-facing services, but we need to extend that into the Airmid space so you know who you've got linked up.
Mm-hmm. And I guess a couple of other questions on other functionality that we have seen lately. So I know that the task element of SystmOne has recently changed, where you can now add files in. I must admit, I've struggled to find any kind of like user guides of how to make that work effectively and stuff. Is that something that's due soon to help us? I know that's probably part of the recent update, I think.
Yeah, I think it'll come out with a notice, and we'll publish some additional information for how that's used. I mean, it's in many different areas of SystmOne that people want this ability to transport documents to us. I think in primary care, of course, the major pathway for that is document management for incoming documents. But I think for individual patients, where you've got a particular inquiry about a particular document that comes in, you'll be able to point that to an individual and say, I look at this document about this patient and give me your response to it. But we'll put a greater guidance out there for you on that one.
Sure. So got time for a couple more questions. If people do want to ask, let us know in the chat. And whilst we're waiting, if anybody does have any final questions, I've got one more that's slightly off topic, but I guess definitely one that's commonly asked. Is there a tried and tested integrated dictation software that can be used with SystmOne?
Yeah, I think it's difficult because there are lots of different sorts out there, and actually I'm now kicking myself because I've now got SystmOne at home running on my Mac, and I've not tried the Mac dictation into this, because generally speaking, if you've got a dictation software that will write into a space, if you click into the active area in SystmOne, you can dictate into it. But we've been working quite closely with Nuance, because they have, like many of these companies, they've got a digital dictation gadget that links into your PC, and we're working with them to actually drive SystmOne using the buttons on the Nuance equipment, so that you can drive through SystmOne and dictate when you need to. That's the old Dragon Dictate, which I think is quite a robust bit of software from this point of view. So we're wanting to make that digital dictation experience better, and so watch this space with that particular bit of hardware and software.
Absolutely. And I guess there are other companies that do also do elements of dictation. So I know there's Dictate It Live, there's Crescendo, and there's Lexicom, if I remember rightly. I'm not sure of the other ones, but it sounds like planned in particular you've got some more functionality coming with the Dragon Nuance kind of dictation system, with particularly their hardware elements. And
I mean, there's lots of interesting stuff going on in that space, of course, because people are greedy to get some of the voice stuff. So you could put your Amazon Alexa device in the corner of the room, and there's some really great stuff going on about how you can actually take the conversation that's going on between the clinician and the patient and start to form a clinical record, even to the point, as you're probably well aware, of using scanners to say when the patient points to their ear, you write down it's the right ear they're talking about. So I think we will see some exciting developments in that space over the next 24 months, really, because it's to be able to create a coded record from a conversation, I think, is very important, and others are already doing that, of course.
Sure. And a really interesting question that's just come in. So hi to Ankit Cat, regular commenter. How do you use SystmOne on a Mac? Can we have some instructions, please?
Yeah, sure. I think the best way to do this, because I'll get it wrong, is I'll get Tom Hardy to retweet his information about this, because there's a product called Parallels, Windows Parallels, which you can download, and that emulates the Windows environment within the Mac operating system, and then you just download SystmOne into that, and it just works. It's elegant, and of course, those of you who have tried the internet first SystmOne means you can actually get the live environment of SystmOne running using your username and password directly on your own Mac device at home. It doesn't yet give you spine related functionality, which is hopefully coming. Again, people will be well aware that there are the move to having a digital smart card, so you don't actually have to lug around the real smart card, and more importantly, you don't have to have it reprogrammed if you're changing your role. But there are two. The NHS Digital are up and running with one digital smart card, but that still needs an HSCN or N3 connection. Whereas we're also working with another company who we hope will be enabled for full smart card functionality any minute soon, which would give you an internet first digital smart card. So we're hoping in a small amount of time, you'll be able to install SystmOne internet first directly at home or a device or whatever, and use the digital smart card to then enable full spine lookup and more importantly EPS, so that if somebody is working from home, they can just they haven't got a VPN token or access to a VPN, they will be able to use full spine functionality within SystmOne. But watch this space on that one.
Okay, we've had a flurry of comments in that time, John. So particularly, Jez has mentioned a few things about how to use Parallels and virtual boxes, another option in terms of using SystmOne on a Mac, and the challenge that it can also face with EMIS. Nick's put another comment in. I'm going to have to read this one because it's quite long. Back with Airmid and knowing which patients are using it, when you're starting a video consultation, how do you know whether to start video consult through Airmid link or through an SMS link if you don't know they have Airmid or not, unless I'm missing something obvious?
I'll take that one away because I don't think I can answer that correctly, because I'll get it wrong. Please, would you forward that one to me, and we'll tweet something about it to follow up.
Sure. And as I said, we will have the SystmOne demonstration at our session on the 16th of December. So we'll hopefully be able to answer more of specifically your Airmid based questions at that time. So make sure you join us on that. So that's 12:30 on the 16th of December. Just like this one will be going live. And obviously, if you can't join us live, you're more than welcome to catch it on the replay. thank you, John, for your time. I think we've
Okay.
taken plenty of it and really appreciate some of the work that you guys have been doing, and particularly around that COVID stuff. I mean, that automatic filing of the results for COVID vaccinations and things, that is just, I think that's going to save a lot of time for practices, and the knowledge that there is functionality to help us manage our clinics and stuff in terms of how we manage obviously patient flow. And the barcode one sounds pretty cool as well, that's going to be up and running. So I know many people have been talking about having integrated barcode readers and stuff. And absolutely, the online consultations through Airmid is going to, I think, be a really useful thing for practice to be using and have access to. And yeah, if you're interested, obviously, check out the links below for sign up for the pilot. But the update comes tomorrow, I believe. Is that correct?
It does indeed. God willing, yes.
Okay. Thank you for your time, John.
Thanks very much. Thank you. Bye all.
Thank you everyone for joining us. As always, if you've got any comments or questions, make sure you feel free to comment. Definitely leave us more comments down below. And as always, eGPlearning is here to help save you and your patients time by taking out any primary care and learning. We'll catch you in the next episode.